Welcome. Thank you. I have posted the agenda in the chat for those of you who don't have a printed copy in front of you or the capacity to work your magical computer to look at two things at one time. We can go ahead and get started. We have a few things before the presentations. When we get to the presentations, we'll let Kevin go first if Diane hasn't joined us by then, and do some problem solving to get her on here. In the meantime, let's have a CPMT meeting. I know you're so excited. Okay, we have an agenda. I posted it in the chat as I mentioned it. Does anyone have anything you'd like to add or change or ask questions about regarding the agenda?
I didn't see it in the chat.
Me neither.
Well, maybe I didn't do it yet.
It's a test.
Look at that. Now I did it. Now can you see it?
Yep. Perfect.
I'll give you a second to look at it. Questions, changes, additions? Terrific. We've already done two things on our agenda. Let's move to the consent agenda. We have to do these things separately, as I recall.
Yes.
Right? We can do the whole consent agenda at a time, but we have to do one for Albemarle and one for Charlottesville. And those things include the minutes from October 2020, which is the last time we had a meeting. I know you guys were grieving over this lost opportunity to connect with each other. I'm glad we have reconvened today. And then the financial reports for November and December, as would be our norm for looking at in January. Any questions, conversations, discussion about those things? Or do we have a motion from either municipality?
Diane's coming on.
Hey, Diane. Do you all need time to read them? I mean, the financial reports would be too much for you to read in the short time, but you probably could breeze through those October minutes.
I move to accept Albemarle's.
Thank you, Suzanne.
You're
Second.
Is there a second for Albemarle or additional conversation? Oh, Nita has raised her hand as a second. Any questions, concerns, amendments? All in favor? Thumbs up or aye? Any opposed? Amazing. Albemarle has sallied forth into the unknown and demonstrated how it's done. Now we need Charlottesville to do the same, please.
I motion to approve the consent agenda for the city.
Misty Graves into the fray. Do I have a second?
I second.
Thank you, Diane. Any questions, concerns, amendments? All in favor? Aye.
Aye.
Any opposed? Incredible.
No.
We have done 1, 2, 3, A and B on our agenda. I'm just saying, rock stars all. And now it is time for the exciting presentation of our quarterly financial reports. Diane and Kevin, did you all have any kind of competition in advance to see who's going to go first?
I always win because I'm alphabetical, but
You
if Diane would like,
You go for it, Kevin.
Diane, go ahead. It doesn't matter.
We have Diane for the year end as well for B, section B. So why don't we go ahead and just start with Kevin, since you're
Hey, I win?
You win.
All right.
Thank you, Kevin.
Now, I can't remember. Do I normally share my screen or does everybody have it? And I mean, typically, if this was a meeting, everybody would have it in front of them. Does everybody have the Albemarle? I'm assuming everybody's got that. So looking at the halfway through, at least the fiscal year, not completely, obviously not halfway through payments, since we can take payments up until September. We're still showing a decline in CSA expenses, down 7.8% in total, 7.5% in local. And the case numbers are down from 250 last year at this time to 223. So about 10 percentage points down there. And I think it was asked, Khaki, I think you asked as far as doing a drill down from, because this is the high level of everything. I did a drill down into from 20 versus 19 as far as there any specific line item that is way down or way up or out. Most of them just look like they're coming right in at that percentage that it's showing overall. So I don't see anything statistically significant that I could really tell you today that I know what's going on. But the one thing I will say, we were up significant last year. So being down here, maybe it washes out. I'm not sure. I don't know. We keep a watch on it, but it seems to be staying steady at where it's at right now, at least for the last 3 months. Let's see here. So for our, so far, let's see here. We're coming in at 63% of our expenditures at our regular match, 34% at the lower, and only 3% at the higher, which is your congregate care, in the chart below. And then you can see where our money is being spent: 45% to special ed, 33% to prevention, 22% to foster care, and non-mandated is an anomaly here, or not anomaly, just not statistically on this chart. It doesn't show up very well, seeing it's very little money. Are there any questions about anything here that you see? I mean, I think this is kind of about the report I gave in October. So it's December holds a little more weight, seeing that we've got 3 more months of data, but we are down so far through 6 months of the year as far as cases and expenditures. Any questions? All right.
Thank you very much, Kevin. Really appreciate that.
All right. Well, thank you all. Have a lovely rest of your meeting.
See you soon.
See you, Kevin.
Bye.
Bye. Diane.
Okay, so we are also way down in expenditures at year to date compared to last December. We are down 13.5% almost in expenditures. We are also down, if you look at the number of children in foster care, we had 7 that were in congregate care this year, 57 in our custody. And last year in December, we had 88 in our custody. Now, part of that is we had 27 adoptions that we finalized last year. And we are continuing to do those. I have been signing adoption agreements, transfers of custody agreements, continually throughout this pandemic. And so it's not unexpected that our expenditure percentages are down also, along with the fact that we have fewer children in foster care right now. Now, that number of 57, it may, you know, that's if we've already received a December POSO. So it may be a few higher than 57 that are in foster care right now. So I don't want you to think that's a final, because these are unreconciled until all the POSOs for that month of service would be in. So that may go up a few children. I don't know that for sure, but that could go up a few children. Whereas the ones I'm looking at from 2019 are reconciled ones. So those are final figures. But that's good news. The adoptions are good news. And I will say that many of those adoptions were relative adoptions. Or at least fictive kin adoptions. So many of the adoptions were by people that already had relationships with the children before they came into foster care. And again, our adoptions continue and have been continuing this fiscal year from beginning in July. And I don't have the exact number on that, but it's another high number. We are really trying to find permanency for children, and then our foster care prevention cases are, they're not climbing. And part of that is, I'm assuming Albemarle has seen the same thing. We have fewer reports, CPS reports coming in, and a lot of that has to do with the schools being closed. They have always been the number one provider of those reports. They've not all been valid by far, but with schools closed and children not being seen daily, and I shouldn't say daily, but 5 days a week in the classroom, it is something that other local social services across the state have also seen that decrease. Also, medical providers are not seeing children as frequently either, and they are another source, large source of our reports. Many of our reports that have come in this year, I will say, have been serious, and many of those are reports that are coming from first responders. And those tend to be some of our most serious reports that come in any given year. So, those have not decreased. Any questions on any of that?
Diane, I'd be curious for you, and also Mary, if you can speak for Albemarle about any sort of plans or concerns about a potential spike, particularly as the vaccine comes on board and the potential of sort of whatever new normal looks like coming back. I know at the beginning of the pandemic, there was a fair amount of conversation around sort of what people thought was a sort of a deferred report to CPS that would then all of a sudden sort of spike referrals. And I'm just wondering if you guys are talking about that, thinking about that, whether there's anybody that has any experience that can predict or draw on that.
I'll speak for Charlottesville. I mean, pandemic is such an anomaly. I mean, none of us have ever faced something like this before. And so, I don't know if we're thinking there's going to be a spike or not. In some regards with this pandemic, I think there have been some things that have helped in a way, such as more food resources, families getting higher SNAP benefits, and then food resources in the community with folks and restaurants and everybody stepping up to the plate. In some regards, some of this now, what's going to happen when if evictions start, that's going to be a whole nother story. And that could bring children into care in great numbers. But we can't predict it. We just really don't know where that's going to lead. And some of it depends on government policies. Some of it depends on, the community's policies. But I, for one, don't feel like we can predict it. Would we be prepared for it? Yes, I think we have the ability to be prepared for it. And some of our staff may have to be working overtime for that influx, but we are, we have the staff that can do it. So.
Yeah, just from Albemarle's standpoint, yeah, again, we don't know what to expect, but I think it's reasonable to think that it may not be at spike, but the numbers will most likely increase again. They've been going down, and then they're sort of leveled out here for a while during the pandemic. They went way down for a while. And they've gone back up a little bit. We're not where we were. So I would expect that go back to at least where we were, which we can manage. We managed it before, we can manage it again. If there is a spike, we have talked about that. I think it's going to be one of those things that we're going to have to deal with when we get it. We only have so many resources and so many staff who are trained in CPS, but we do have the ability to draw on temps and bring others in to do other support services if needed. So it's a sort of where we are thinking about it. And schools also, it's a little bit different, I think, for Albemarle and Charlottesville, because schools are somewhat open in Albemarle County off and on. And so kids have been in the classroom some. And so I do think that, we have at least eyes, there are eyes at least on some kids some of the time, not anything like when schools are completely open, but there is that level. I don't know how that's done to our numbers though. I don't know if we're getting calls from schools. I'm not aware of how that's changed anything, but.
Thank you both. Does anybody have any questions? Particularly of Diane around the financial stuff? Excellent. Thank you so much, Diane. I really appreciate it. Moving on to Albemarle has a provider revision that was sent, I think, today. Yes, Jennifer, is that one of the ones that came today? So
yeah, it actually, I think, got sent out previously, but when we weren't meeting, like we canceled. So I didn't realize it hadn't gone out. It didn't go out with this for this meeting. So this is the provider agreement revision for bridges. And it's one that Region 10 really needs to have access to. And so we've worked really hard to try to make this happen. It took a lot of back and forth with the attorneys, but we were finally able to come to an agreement. And so that's why the document's kind of long, just because of all the back and forth between them. But this is where we landed. And so it's here for your approval.
are there any questions about the provider revision? So we'll need from Albemarle only a motion and a second and a big exciting formal vote.
I move to accept.
Oh my God, Suzanne, you're on a roll.
I am. I know this unmute button. I'm good at it.
Any friendly amendments? Do I have a second?
Second.
Thank you, Martha. Questions, concerns? All in favor? Aye or thumbs up? Any opposed? Very nice work, Albemarle. Good job. Okay, now we're moving on to section 6 of our agenda. This is incredibly exciting and very fast. We have a FAPT update. Who's doing that today?
So I'll do that part. So for the FAPT update, there's not a whole lot to say. I did also send out today with the provider revision, the FAPT survey results for Albemarle. So hopefully folks had a chance to look at it. As you can see, we mailed out quite a few. The return obviously is a lot, lower when you're mailing stuff out. But it continues to be positive feedback. And so we feel like the comments actually are more helpful sometimes than just the numbers. But again, it continues to be positive. And so we feel like it's working, that we're doing these through the Zoom. And so that feels pretty good about how things are going.
Any questions around FAPT? Particularly about surveys? Okay, moving on to the review of routine foster care expenses. I'm certain you all opened all of those giant zip files and read every page. Any questions? Excellent. And now CSA coordinator update.
I can start with that.
Thank you, Jess.
Trying to think back over the past couple of months, what updates we had for you guys. I think one of the main things, and I think we sent this out to you guys, was the JLARC report around private day schools. And just wanted to kind of summarize the main points that came out of that report, because it was fairly long. I'm sure you guys don't want to have to read the whole thing if you don't have to. And so basically, some of the main points were taking the money for private day schools out of CSA and moving it into DOE, allowing us to spend CSA money in the public schools, which I know has been a topic of discussion in years past. Increased oversight by the state for private day schools. And then they also mentioned having kind of a general statewide contract for localities to use, or provider agreement. And the other thing that came up in the report talked about referring kids to FAPT for services to be provided outside of the school setting, which we feel like we already do a pretty good job with using our SPED wrap in Charlottesville and Albemarle to meet that purpose. So that wouldn't be that different for us, at least. But those were kind of the main points of the report. And it sounds like, Jennifer, you might have more of an update than I do. There's a deadline of November, Jennifer.
So yeah, so I guess one of Jay Lark's presentations was to a subcommittee about making that recommendation that VDOE have a plan by November 2021 for if that money were to move back to DOE, the plan for how they're going to set it up. And that includes like, is there going to be a match? Is it going to be some sufficient, sort of answering and detailing all those questions? So it's a matter of whether the General Assembly is going to move that forward. And then if they do, the recommendation was to have the plan by November 2021, and then it would go into effect July 2022.
So pretty significant change in how that's been administered before, or up until now. Any questions about that? And, you know, as we get more information, we'll pass it along.
And if there's any opportunities for us to weigh in as things get proposed, I'm sure they'll come to us too.
Yeah, I'm not sure, you know, what has come through the schools. I'm sure there's been talk about it there too.
And I think
I
there
shared-
are, sorry, go ahead.
No, I was just going to say I shared these recommendations with Kevin. We're not happy about the money moving to VDOE. It would make a huge difference, but other than that, that was the biggest concern.
And especially if it's not clear whether or not it's sufficient too. That's going to put a big hardship on localities if not.
Yep, it sure would. So that's a huge concern of the schools.
It seems like they've been creeping up on this for several years, sort of making minor sort of either conversation or changes to get to this place that will have actually a pretty significant impact.
And I don't think we had anything else in terms of an update for CPMT.
Thank you. Are there OCS communications? It seems like there's one, yes, maybe two.
Yeah, there's two. I don't know if folks
Trying to pull them up.
Yep.
Where's
That's what I was
Lisa's
doing.
email?
Well, one of them was actually from October, I think, or earlier.
Let's see. Let's see, the 2021 was about the changes that are coming to the congregate care funding, and that has to do with 4E. And so, you know, we've talked at Albemarle about how once we actually have more facilities that are going to meet the qualifications for being the PRTFs, that we may look at sort of making this a requirement because 4E would pay for this. But right now it's just, it's very limited. And there's obviously a lot of parameters around how facilities get approved. And so we don't look for there to be a whole lot of them right now. But once that changes, it may be worth looking at how, you know, foster care placements are with facilities are used. So
Yeah,
that's.
It all has to do with Families First, that I guess is supposed to take effect June or July of this year. Maybe somebody at DSS knows a little bit more than I do. July. And in terms of what 4E will and will not pay for. And we haven't received any information down from OCS yet about how this might affect our CSA policies or any like change in process that we need to make or any policies that we need to create. So more to come on that. But I think across the state, there's concern about lack of available placement options in general. I mean, we already have that concern in the first place. And now it's what can we pay for and where can we place kids in foster care? And so it just complicates it a little bit more, but more to come on that. And if anybody else has more information than we do, please share.
Can someone say what PRTF stands for?
Psychiatric Residential Treatment Facility.
Thank you very much.
Uh-huh.
And then it does seem like we had a conversation about Families First, a brief one maybe a year ago, but it seems like it might be worth it as the deadline's actually coming up to have a more robust sort of presentation about what it is and what it isn't at the sort of one of the next follow-up meetings.
Yeah, and we at the state, in our state meeting, they had folks come like twice, and kind of loop us in on what is the latest and greatest on what's going on. But in CSA world, I feel like we haven't heard much of anything other than what we've heard from our own DSS agencies.
So is it like, should we be asking our DSSs to do the sort of spearhead that conversation about what Families First is and isn't for the next meetings? Is that who the logical presenter should be?
It's coming through DSS. I know they're working with, other state agencies, and obviously, CSA, OCS are involved. But.
I don't know that our next meeting, we would know enough clarity to present something, because I mean, it's been, 2 years now that it's coming, and yet we still, DSSs, I don't think have clarity. Correct me if I'm wrong, Katie, but.
COVID only slowed things down, right?
Yeah.
I saw Mary smile, like it was like a little bit of a smile and a little bit of a grimace at the same time, so I suspect she agrees.
I do. I was just thinking, I don't even know what we would present. We had to present it. It's just, I mean, it's, there is some clarity, but there's a lot of uncertainty. And July is the earliest date. It keeps getting moved, and I wouldn't be surprised if it gets moved again. So. All
right. So we'll think about it for May or June. And if we still don't know anything, then we'll push it some more. But it just
sounds great.
All of our minds. Thank you very much. And program committee, Mary, are you presenting for program? No?
That's me.
Christa. Christa, thank you. Sorry.
This is our new program chair.
Excellent. Yes. Thank you, Christa.
Me. So as far as the parent surveys, we are probably in our third revision of the new satisfaction or family satisfaction survey. We decided that there wasn't enough in it to get at perhaps systemic racism and culturally competent services. So we are running it by the Office of Equity and Inclusion to ensure that we are able to appropriately capture that. So hopefully next month, we'll have an update or one ready for everybody to review. If not next month, probably March, but I believe we were hoping for next month.
Yeah, that's the plan.
And then the for UR, I know we had decided that, or we talked about Region 10 conducting our UR, and what we wanted to know from CPMT, and I know we're looking at mentoring, but what type of percentage of cases do you expect to be reviewed? For example, are we looking at a specific period, a specific point in time, and the sample size to pull? We were just looking for some guidance on that.
Great questions.
So I think one of the questions was sort of Region 10's capacity to be able to do UR for these cases. I can't remember how long ago it's been now. Katie and I did sort of a point in time snapshot of how many cases we had. And so we were thinking, I can't remember the exact number. I think it was.
I want to say it was like 70 or 80.
Oh, okay.
Time was the case, like total between the city and county.
So if we were to do 10%, you know, is that a manageable number for Region 10? There's sort of a question around that.
Obviously, the more data we have, the better picture we're going to have.
So I have to look into that. I lost Crystal. She would know. So I'll work with Alan to see what our capacity is. At this point, I'm not really sure. Our caseloads are super high. We're not sure why in case management. So I'll check with Ellen, our new director.
Does seem like the more the better in terms of understanding. But so it sounds like it would be driven by Region 10's capacity. And if we were dissatisfied with that, then we could try to find another resource to help with the actual review. In terms of time frame, it makes sense to me to try to do something that's more that's closer to us in time than further away, unless you all think that looking at the last year would be too anomalous around mentoring to actually give us a picture.
Yeah, at the last meeting, we asked the Region 10 person that was there, I'm not sure if it was Ellen or Amy, to try to go back and get some more information about capacity, and then to the tool that would be used, because I feel like there's maybe a standard UR template, so we could look at that and see if that kind of gets the information that we want, or if we wanted to customize it at all. So it's, you know, program's still definitely kind of working on it.
And right now, Amy's the representative, Amy Hummel. Okay. I'll get with her and we'll get some ideas to you guys about numbers and tools.
Okay. Yeah.
Christa, is that sufficient guidance, or do you need something more specific?
Nope, that's helpful. So I'll take it back to programs. Thanks, Katie and Jennifer, for helping me out there. We'll take it back and hopefully have something more specific and laid out to bring to you guys next month.
Awesome. Now we're moving on to other business and work plan review. And I don't think we know we have some data stuff for our part of our work plan to look at for February, so we don't have anything on the agenda. Specifically, I would like to just make a comment about something I want us to talk about when we actually update the work plan, so that it's in the minutes. So I'll remember, and I know Lisa will remember because she never forgets these things, which is always amazing to me, that having a conversation around diversity and inclusion and representation and leadership, particularly around CPMT, around FAPT, and around program, that as we're all in our individual, both sort of government agencies and private agencies, working really hard to make sure that the folks who are making decisions look like the folks who are being impacted by those decisions. I think it's important that we have this be an intentional goal for us at the CPMT level as well. And that may include reviewing membership for FAPT and program and other ways in which we're getting guidance in these sort of high level decisions here, but more likely around the sort of individual family and child decisions, like around FAPT and programs. So anyway, I would welcome comments or thoughts on that now, but want to just make sure that it gets part of our work plan update, that we have some conversation on how we do that. We are a big bunch of white women generally at all of these levels, and it's on us to try to change that. Any thoughts or comments about that? There'll be a great opportunity for us to chew on it when we get to the work plan update. Agency updates.
I have one update. I will be retiring soon. So I hope to make my last meeting with you will be in February. And I just want to say that I will miss all of you. And it's been a pleasure to serve on CPMT with all of you for many years, some of you for a few years. And this was not an easy decision for me. I actually, a year ago, planned to retire September 1st of last year. And I just couldn't walk out with the pandemic and where the city is. But it is time. It is time now. And I just want to say it has been an honor and a pleasure to work with all of you. I just know all of your hearts are devoted to our city and our county. And I know the work that you do is not always easy. In fact, it's often difficult, I know. But I will take a piece of you with me always. And I feel like I'm a better person for having known all of you. So I'm saying this, but I hope to still see you at our February meeting. But in case that doesn't happen, I wanted to let people know now. So.
Congratulations and thank you, Diane. And I don't know how we're going to pull it off for a virtual cake in February, but something like that seems appropriate.
With the weight I've gained during COVID, I don't need cake. But
well, that's the whole beauty of virtual cake. You can eat as much of it as you want.
It'll just be nice to see you all. So again, just thank you for everything you've added to my life and everything you are doing for our communities. I do so strongly believe that each one of you and all of you together are making a very positive difference for our children and our families.
Thanks, Diane.
Thank you, Diane. Any other agency updates? That was a big one.
Khaki, yeah, now I have to do a dry one. Did you want me to go over the Marcus alert?
Yes, that would be really helpful. I was hoping we'd do that. Yeah, thank you.
Yeah. I'll miss you, Diane. Gosh, I've known you for years now.
Thank you, Nita. Thank you.
Okay, so this is, I kind of had Lisa brief me, and then I have the cheat sheets, which I can share ultimately, but I'll be looking at it while I present. So as you guys know, the Marcus Alert bill gives the responsibility for implementation, oversight, and development to DCJS, the Department of Criminal Justice Services, as well as DBHTS. So they will be doing that together. And at this point, there will be a state group in addition to our local group. In the state group to hammer this out, we do have 2 local representatives. We may have more, I just don't know about it, but Myra Anderson is on the state one, as well as Anna Mendez for Partners for Mental Health. And so our locality right now is represented like that. You probably know locally that Lisa Bites is on the local group. Khaki, you're on the local group. I think that's it for Region 10, but that membership, so we'll be participating in that as well. The Marcus Alert bill really lays out sort of 2 levels of, so there's a community care team, and they'll do work on that. And then there's a statewide system work. And so the statewide system work is really about having a single crisis call center that's by region. And so that ultimately calls from our locality goes to a regional call center that then deploys local community care teams. At this right now, we're in pilot phase, and the pilot phase is by region. So there will be 5 pilots, 1 from each region. Our pilot is through the Northwestern CSB. So they will actually be the ones in our region that receives funding from the General Assembly to create their community care team. And I'm not sure if they're going to host the regional call center. I don't think so. I actually will wait to see how that regional call center, my guess is it'll be Horizons, that's in Lynchburg, will host that for us. As far as dates, what we're looking at is there is a requirement that a plan be created by July 21. That's sort of how, let's see. I think July 1st is sort of locally how these organizations, DCJS as well as DBHDS, plans to roll that out and create a plan. And then the regional pilots will have a plan and begin to pilot this, the Marcus Alert, in December 21. And so we'll watch how that unrolls. So in July 1, 2022, every locality will have established protocols that work on how diversion's going to occur, when the calls come in, and their plan of rolling out their community care team. In 23, there will be funding for 5 more community care teams, and they'll probably do it 1 per region. And then in 2026, July 2026, they are aiming to be done. So that is sort of the time frame. I'm happy to answer questions. I know I didn't go over that well. This isn't in my area, so I'm sort of just learning it as I go. Any questions about either the community team that operates at a community level, and then this sort of more system response that's across state of Virginia? Those local teams will be efforts to respond without police. That would be seen as diverted. Call goes to the call center that covers the region. They help determine, yes, this is good for a community care team. Members of those community care teams would be, let's see, I think I have that list. Peer providers, potentially community family members, crisis workers, could be city, county, local government, and medical services.
Nita, is there a conversation that's happening in parallel about providing diversion placement opportunities? Because the care team is sort of like a facilitating team. And if we're diverting away from jails or away from hospitals, it seems to me, in order for this mechanism of diversion to work, there has to be an expansion or increase in the number of sort of more voluntary-based community settings, whether they're residential or intensive sort of day treatment options. And I'm wondering if the state is imagining that as part of the rollout between now and 2026, or are they just hoping we'll figure it out on our own?
So good question. And all of this is in conjunction with Virginia's STEP Virginia plan that rolls out sort of rolls out service expansion, capacity expansion, as well as new services. So for example, on that STEP Virginia plan, having a partial hospitalization program that offers intensity beyond an intensive outpatient program that serves SMI folks, could have a partial hospitalization as well as SA partial hospitalization. So yes, STEP Virginia hopes to expand and fund peer support. So we should have more. Medicaid's adjustment to some services such as partial hospitalization and some, I'm sorry, I have a teenager now interrupting me. What? You're leaving? Okay. Sorry, little parenting moment. So that's the hope, Kaki. So how they've done that to build capacity is they've adjusted some of the Medicaid reimbursement rates. You know, we don't have a public partial hospitalization because the funding is like ridiculous, the payment. You can't build a service on that. So that's sort of how they plan to do that. Now, as far as residential places like the wellness recovery, you know, that's like, you know, we'll see, because the beds stay full now. In COVID, of course, it's super full with wait lists because of our reduction. And I don't know that that's a target, residential placements, but certainly crisis stabilization, crisis intervention, partial hospitalization, peer support, as well as a big push with Families First for the evidence-based practices they've chosen for children and families. Does that answer?
It does. There's a lot. I mean, it seems to me like in order for it to be an effective mechanism of diversion, there has to be some place to divert folks who have greater need than just a sort of defusing and mediation in the moment. So, you know, as to the extent that certainly the Charlottesville conversation has started connecting this with the defund the police conversation around how it is that you sort of manage that process. I feel like it's not just a matter of who responds to the call, it's having the resources for the person who has the need that gets appropriately identified at that call. So anyway, I'm worried about that for us in general, and I'm glad that the state is pairing this with some idea of expansion or increase in service.
And they're timing it with their STEP Virginia to expand mental health services. But I will add, I have the same fears you do, Kaki, and my fears are like housing resources. I think will be huge, you know, and is there funding for that? No, you know, is a housing person specialist on that team? No, but things like that, I think crises happen. Yes, they appear mental health, but what's driving them is often a lack of resources related to poverty.
We'll just solve that by 2026.
Yeah.
Okay. Thank you, Nita. I appreciate that.
Mm-hmm.
Are there any additional questions for Nita around the Marcus bill? Okay, we're coming to the end of this meeting and it's not even 4:30. And so it seems like a really good time for us to have a brief check out focused on how it is you're supporting your staff or your colleagues through this incredibly difficult time, particularly at a difficult time where the events of the last 2 weeks have been incredibly illuminating and somewhat terrifying. And we're also this idea of a vaccine that's coming soon to a location near you, maybe already there. Combined with exhaustion around the pandemic, I think it leads people to think we can let our guard down, but this is actually the highest risk we've ever been in the pandemic. And so I'm wondering how it is that you're using your superpowers to help your staff cope or your colleagues cope. And I think we have enough time to do this in real conversation and not in the chat. We might steal each other's ideas, see?
Well, I mean, one thing that we've done, and hopefully lots of your staff have taken advantage of, but they certainly are welcome to, is that every Friday, Sarah Robinson presents sort of resiliency, talks through resiliency around COVID, that we've just, once our staff started giving us just really good feedback around how helpful that was, we've opened it up to anyone can attend. So let me know. Staff have found it helpful. She's a great presenter, and it's all her information, of course, is trauma infused. So I think that has been really helpful for Region 10 and our community.
We've been holding twice a month town hall meetings with Zoom for staff. Zoom, sometimes it's WebEx, but and those meetings are not mandatory meetings, but we tend to have about 40 to 50% of our staff attend the meetings. And basically we discuss anything that may be on staff's mind. So it's not a set agenda. And our next meeting is tomorrow. And we try to have as many of the management team as possible be on those meeting calls. And often, Katie knows this, often we talk about, when do we have to open the building to the public? That's a big concern, but a lot of their concerns at this point are health concerns and you know, when they're going to have to come back into the office in person kind of thing. And you know, those are concerns that, you know, there aren't any easy answers to them, but you know, as far as what I can say to folks, you know, is that I'm very supportive of until we get this virus under control. And as long as we're getting our work done, which staff are getting it done, most of them virtually, there are a handful of people that have to come into the office. They can't do their jobs virtually. But that handful, you know, there's strict requirements for temperature checks and masks and all of that. And everybody has been, I mean, I should say every single person has been very attuned to what is expected and been complying with what has been expected in order to be in the office. So, you know, that's, you know, again, like I said, our next town hall meeting, which is virtual, but it's nice, you know, it's nice for people to at least see each other's faces and hear each other's voices. You know, it's an optional thing, but we have a lot of staff that do sign on to those. So.
So Diane, if you're done, I'll
Yes.
go next. So, and Christa, you feel free to join in. I think it's a little bit different for us because we have smaller staffs, but lots of geography and lots of little offices. And so we've done teleworking in our larger offices. And at one point we're back to having staff in, all of our staff back in. We've stepped that back a few weeks ago when things escalated, but we still have our single person offices. So the supervisors still have a lot of face-to-face contact with their staff and are doing an incredible job, I think, of supporting them and being flexible with folks' needs. And, you know, we had a situation now where we're short-staffed in the northern end of the district, and Christa's sending people out to help from the Charlottesville office. So our folks have really been in on some limited basis the whole time. And I think for the most part, we've been incredibly fortunate. People have responded well to the protocols that have been in place, and it's felt like a safe place. And you know, it's been interesting just to see how it varies from office to office. But I think the supervisors are really responsible for doing a great job in maintaining that personal contact with staff and supporting them and continuing to push forward with the work that they need to do for the children and families. It's been interesting. Christa, anything to add?
Nope, I think that sums it up. I think the actual face-to-face contact and being able to have that communication with our staff has really helped a great deal. And then of course, having some flexibility to allow them to work at home extra or kind of flex out their schedule as needed. I think that's really helped.
Recently, Misty and I gave 2021 gifts to the staff of a plant to remember that growth happens. It's a succulent, so it's small. It's also grows slowly in low light conditions, low water conditions. It's a resilient little thing. And a book on being human, just a reminder of self-empathy and thinking about your taking care of yourself as a human being. And then a collection of cards that we curated that they could send to their colleagues in support, so that that sort of reinforce this idea of mutual aid. And it really just never feels like enough. I'm so completely overwhelmed and amazed by how resilient and focused they are, despite the incredible context that's so difficult to concentrate, so difficult to really remain focused on doing the things that you have to do. And then if you have a crazy political context like we happen to have in Charlottesville, and honestly everywhere else in the world at the moment, I mean in the country, and it's just incredibly difficult. And the fact that they stay so focused on the mission is really admirable. And anyway, I do think it's important to spend time thinking about how we can help them, the folks who are doing this work, and also to think about how we can help each other in terms of providing those the sort of small informal supports that keep us going in the work. This is a hard context. And finally, to remember to take care of yourselves, whatever that looks like. I mean, I say that, but I really don't think drinking on the job during the day is, so it's not really whatever that looks like. It's, you know, within reason. But just a reminder to take good care of yourselves during this time. Anything else that we need to tackle on this agenda? Anything else for the good of the order?
So, Kaki, if I could just add one thing, we didn't really do a CSU update, but as you know, and most of you have heard me mention before, we're been working on some system reform following training program in Georgetown back in November of 19. Without the pandemic, we would have been much further along in this process. But I think it's another amazing thing that we've managed to persevere, and it's probably been a source of encouragement and excitement most days. Some days it feels a little overwhelming, but we had envisioned when we started this process that there would be a large kind of kickoff or launch, and that we would have a forum convened by Judge Barreto, and all our community partners would be invited, and we would get feedback from children and families about how to enhance this work. And of course, now all that's going to happen virtually, and it's broken down into small segments. But we're, I think, finally at a place with Georgetown when we envision that happening before too much longer, within I think early February. Christa, is that the date we're still looking at?
Hopefully, maybe mid-February now, but fingers crossed.
Yeah. So we'll be looking at small blocks versus a huge event. So we're looking forward to that, and to sharing with all of you all in our community what we've learned and what we hope to do to make our work better.
I'm Really looking forward to the results. It's been really fascinating to follow along with Hunter's experience on as part of the team, and really curious to see sort of how it gets launched from here and how it impacts kids and families in the community. I think it's great, and I really appreciate your stamina for the process, because it has been a lot longer than you all expected.
Yeah, it has been different, but I really think one of the exciting things for those of us who were involved in the DMC work years back, I mean, some of the themes are very similar. And so I feel like, okay, we're not forgetting about that. We're going to really do more about that now. And that feels really fulfilling. So
Yeah.
Hopefully we'll continue to push forward.
Anything else? Go forth, do good work. We're adjourned. Thank you.
Thanks. Good to see everybody.
Take care.
Do I need to do anything, or is that it? You're muted.
Sorry.
Oh, no, it's all right. I heard you, I saw you moving, but I didn't hear you.
No, I'm going to unrecord it and we're good to go.
Awesome. Thank you very much.
Thank you.
See ya. Bye.